Good afternoon. I'm Adriana McIntyre, an assistant professor of health policy and politics here at the Harvard T.H. Chan School of Public Health. This event is part of the Dr. Lawrence H. and Roberta Cohn Forum series. The studio thanks the Cohn family and welcomes them, along with all of our in-studio and online viewers today. We're joined today by two guests who have spent years in the rooms where health policy happens, bipartisan health policy happens. Melanie Egorin served as Assistant Secretary for Legislation at the Department of Health and Human Services and in the Biden administration, and is now a professor of the practice in public policy at the University of Virginia. Before those roles, she spent 10 years working in the Democratic House Committee on Ways and Means. Brian Sutter is the former staff director for the Health Subcommittee of the House Committee on Ways and Means, where he served Chairman Dave Camp, a Republican from Michigan. He is currently partner and CEO at Capitol Hill Consulting. In the next 30 minutes, we'll start by demystifying how bipartisan health policy is really made, then walk through two case studies, the Affordable Care Act and Medicare Advantage. We'll close with concrete advice for those of you who want to work on bipartisan health policy yourselves. So for both of you, when we say how bipartisan health policy is actually made, what are the biggest misconceptions and what would you like to correct for this audience? Melanie, let's start with you.
I'm going to start with bipartisan legislation and conversations do happen. Brian and I often, when we work together, talk daily, if not more. And sometimes it would be in the midst of fighting about one thing that was hyper-partisan, that people spent a lot of time watching on TV or reading in the papers. And then there was a whole bevy of work that we did to make the American healthcare system better that nobody cared about as much because it wasn't newsworthy. But it was really important in making Medicare, making the Affordable Care Act, making health tax work better.
Yeah, Melanie's absolutely right. I think while we might be fighting something on the floor or some really public pronouncement that came out, we might also see some announcement from HHS or CMS that caught our eye and say, hey, what did you think about this? Is there an opportunity for us to work together? That happened regularly, frequently. We think about bipartisan legislating in the product that comes to the floor and is signed by the president. There are weeks, months, years that lead up to that, and it doesn't happen overnight. So we have to build a level of trust in one another and to be able to bounce ideas off. And fortunately, I had a wonderful partner in Melanie to do that.
And can you say a little bit more, both of you, about what building that rapport looks like over time and when it's maybe most important in your policymaking careers?
It doesn't happen overnight. Right, like any good relationship, it starts with, hey, we have a common interest and a common goal, and let's get to some place where we can all agree. Health policy, doing it in the microcosm that is the Hill, is really, really hard. As we see today in the media, people want to talk past each other. You have to really stop and reflect and think, okay, how do I listen to that person? Is there areas of agreement? Oftentimes you have to say, we're going to have to agree to disagree and put that aside for the time being, and let's focus on where we can agree. And so we were fortunate enough, and I think Melanie, her past work at GAO, really, that was the linchpin for us to say, hey, you've done some outstanding work in your professional capacity before coming to the Hill. Let's work on that, see if we can find common ground, and fortunately we were.
I think about it, it's also going beyond talking points. If we just stopped talking to each other based on the bullet points of our two positions or the positions of our bosses or our parties, we weren't going to actually do the policy work of getting to the details and seeing where there was commonality. I think over time, I could often preemptively know where the pain points were going to be in our conversations, know where Brian's perspective and the perspective of the Republican Party was going to not be in alignment with my perspective or the perspective of the Democratic Party. And if you walk in saying, okay, I know we're going to have tension and friction here, but where else can we get to agreement? What are the challenges we see to make the system better? It allows and I think we also were both willing to compromise. Mm-hmm. We knew where the bright lines were and what we couldn't compromise on. But those were really few and far between. And I think that's also a little bit of a difference of the environment you and I, I'm going to say, grew up on in the Hill, where incremental change and the view of what are you doing on behalf of the American people was valued. I think there's been a little bit of a shift to you aren't fighting enough. And you aren't listening, you are listening too much that is perceived as a weakness and not a strength.
Yeah, and I think we had deadlines that we oftentimes were set to respond to. And I think when we came in, and I know we want to talk a little bit about the environment there, but my boss had been on the committee. He was somebody that always believed in good policy makes good politics, and so he focused a lot on the policy side of things. And we wanted to refresh, and I think a lot of what we ended up doing was there was an expiring program. Let's not just kick the can down the road. Let's get in and let's dig in. Let's say, can we do a better job, both for patients, but for the program and for taxpayers? And again, Melanie was such a wonderful counterpart to doing that, to look at some of those questions and say, yeah, we can do better.
Great. And we're going to talk about these two case studies, one that's hyperpolarized, the Affordable Care Act, and the other that's really bipartisan, Medicare Advantage. But before we dive into those, can you step back and reflect a little bit on the balance of hyperpolarized work versus the sort of everyday work that needs to get done and often does get done on a very bipartisan basis?
So there's no this is what I will say to students at the end. There's no typical day on the Hill, right? There isn't a this is how I account for my time. There are days that are hyper-partisan, and there are days that are incredibly bipartisan, and there are days that are incredibly learning so that you can be bipartisan and find that shared agreement. I would say the majority of the time is spent in those second two buckets, that you're spent sitting in meetings, or meetings would come and meet with me, and then they would meet with Brian, and then Brian and I would call and be like, so what'd they say to you? What'd they say to me? It's kind of to see where the policy was going, to see what the direction that we could find solutions were.
Yeah, I mean, I certainly, elections always have consequences. And, I think when the Republicans took over post the 2010 elections, they wanted to do things to really focus on those achievements that the Democrats were able to get done, namely the Affordable Care Act. So you had to do that, right? That's what the members that were elected at that time wanted to see. Meanwhile, you knew that the Senate wasn't going to be able to do that because of just the makeup there. So you had to check that box. And you have to do that in a way that, allows the people to think like they are doing what their constituents sent them there to do. Meanwhile, we also knew we had other very important priorities to there. And you also know in the House, your time is limited, whether that's for Republicans, our chairmen are term limited, or just the majority flips in 2 years. You're on the clock from day one. So you've got to walk and chew gum and do all of those things. Otherwise, you might miss an opportunity, and you don't know when those opportunities are going to arise. It might be tomorrow, might be 6 months from now, might be 2 years from now. So you've always got to be doing the work. And the process for some of these things is, we're going to draft legislation together. We're going to get technical assistance. We're going to sit side by side at CBO. Those things all take time. So you've got to put that time and effort in right away, while still doing those other things that might be more attention grabbing in the headlines.
All right, well, let's turn to that attention-grabbing context, starting with the Affordable Care Act, or the ACA, which famously passed on a largely party-line vote, and after the midterm elections, Republicans won a large majority in the House, running on repealing it. That was the environment in which you two were working in the House together. Brian, what was your mandate coming in, and how did that shape your day-to-day work?
Yeah, I think there's a lot of frustration post-ACA, both on the process of how that law how it became a law, right? It was the House had passed something, the Senate was about to moderate, but then they lost the 60th vote, so they had to switch over to reconciliation, which is a traditionally more bipartisan, but now a more partisan route. And there was also limiting on what they could and could not fix. And I think that's the environment that people came in and said, boy, what are we doing? And it was reshaping a significant part of the economy. So Republicans said, look, we think we've got a better way. We had drafted an alternative. We had coalesced all of our members around. We have to do that. We have got to move that thing forward. So we did kind of the wholesale repeal, but we also did bite size. The Innovation Center hadn't really started yet. So what is this money going to go for? Is this the best use of taxpayer dollars? So those were the things that we were challenging on a day-to-day basis.
I like that you said on a day-to-day basis. There were 70 votes to repeal or undermine the...
Early on, yeah. The 75 took a long time, though.
At the 75, yeah, it took 5 years.
Yeah.
But so there was still to keep your members.
Yeah.
And I will say this is part of it, is knowing how to move the conference or the caucus. Those votes were really important for allowing us to do the bipartisan work. And I don't think that part of the tension was always recognized.
No. And I think, conceptually, even though when sitting in the minority when it passed, yeah, there's going to be repeals and there's going to be a tax on the bill itself. And I thought, that'll be a couple of years, right? It'll work itself out. And then we're going to say, okay, what can we do to make it better? That didn't. I mean, we were in a hyper partisan environment. We were able to make some changes, right? Like, that's not without the work that was done. Oh man, this is a repeal, but that's not a bad idea, and we're feeling some pressure on these entities. How do we change this particular policy? So a lot of those conversations happen off to the side. Sometimes you gotta let the air out of the balloon so it doesn't explode. But then it's like, okay, no, if we did this a little bit more targeted, that could do things. Expatriate healthcare comes to mind, right? We worked on that. The ACA applied the insurance requirements to all domestic insurers, regardless of where you sold the claim, whether that was in the United States or elsewhere. Well, those insurers that were selling American products abroad were at a disincentive against their Israeli or counterparts from Singapore or India. How do I compete on that? I still want to serve Americans in those foreign countries. We needed to have an exception to the ACA for that. Was that a repeal? Was that a refinement? We wouldn't have gotten there had we not had conversations in the midst of all of those much larger repeal votes.
Yeah, and Melanie, could you elaborate on that a little bit? What it felt like what it looked like to basically watch Republicans vote to repeal, but then know that you were going to get up the next morning and work with Brian on something else.
It was hard, right? The ACA it is a signature accomplishment of the majority in President Obama's first term. And it really did what it accomplished. And I think that when we talk about the partisanship, and I will talk about what it meant to kind of go into battle, which is what it felt like, but it really did what it was designed to do. It expanded the number of people with health insurance. It made health insurance better. It reduced the number of uninsured. When I left the Biden administration, we had 24 million people who had been covered, and it expanded the social safety net. At the same time, it was a place where I felt like I was always defending it. I was always sort of in a crouch posture, waiting for what is the next thing? What is the next shoe to fall? What is the next bad news story? What is the part of the law that was to be implemented that wasn't being implemented because of lack of resources? One of the things that the Republican majority did was limit the funding to support the ACA. But also, just some of it is when you make policy, you dream really big, and not everything comes to fruition. But from the outside, because of the hyperpartisanship, every small failure was seen as a cataclysmic disaster. And I'm not sure they all were. I think some of it was the systems adjusting and the larger healthcare dynamics adjusting to new regulations.
Great. So anything else that you guys want to take on the ACA, reflecting on what it taught you about bipartisanship and the importance of the relationship that you guys maintained throughout that time?
So when I took over the ACA portfolio in 2012, I was told 2015 was going to be the year that we could do bipartisan work. And I still hold that 10 years later. I still believe that there are places where there are improvements that need to be made to the Affordable Care Act. There are improvements that need to be made to our larger U.S. health care system and how people get health insurance. So I think the problem is, and I jokingly still watch hearings, and I'm like, oh, I need a safe word. I need something that lets me pull the parachute and get out of this thing, because we haven't gotten beyond the talking points, right? It is still, instead of being like, this is really serving the American people, right? When people lose employer-sponsored insurance, when their children become 26 and lose health insurance, but don't yet have the type of job that provides health insurance, they can go into the exchanges. They can still have health insurance. As a mother of a child that's about to graduate college, that's really reassuring to me, because what he wants to do for a career path may not come with job-connected health insurance. So I don't think we talk about those victories. I think a lot of the reforms that Republicans are championing right now really require a stable ACA. Mm-hmm. And I think that you guys haven't quite circled that square as a party to say, we want to do this. We want to move towards more individual responsibility, but in order to do that, there has to be a marketplace for it.
Look, I think this is one of the reasons why Republicans had such a hard time coming to a consensus on an alternative. Republicans have a hard time talking about health care in the way that Democrats do, but that doesn't mean that they don't hold those ideals any less fervently than their counterparts. They just question about whose role is it, whether it's the state government, the federal government, the individual. They struggle with that, and so what we ended up doing in our alternatives is focus on costs and how do we drive those costs. But I think Melanie's right. You look at some of those things that the Trump administration has done, and from the definition of the ACA, they aren't the comprehensive health care that the Democrats had written into the law. My viewpoint is, look, if we want to have that discussion about a continuum of healthcare, let's have it. Let's meet people where they're at. So maybe it is a catastrophic coverage. Maybe it is a short-term limited duration plan. How do we bring this is the notion of insurance. If we want to get people engaged and keep them engaged, at some point, the 22-year-old who's invincible is going to have a family and want more comprehensive coverage, and they should be able to buy that. But if we expect them to buy that the first time, they never will. And I think that's a disservice too. So how do we begin to have some of those conversations? It's hard. I think you're right. There are factions on both sides that are just like, nope, I'm going to stick to my corner. So we got to find that middle. And it's hard right now.
Yeah, great. And so let's pivot now to an issue that is more bipartisan, which is not to say totally uncontroversial, Medicare Advantage. So Medicare Advantage, or MA, is the part of the Medicare program where private health insurance plans provide coverage to beneficiaries, and it now makes up more than half of Medicare beneficiaries. More than half of Medicare beneficiaries have their coverage through these private plans, meaning MA is central to any serious conversation about Medicare's future costs and benefits. You've both spent years working on MA, both on and off the Hill. So how do you approach your stakeholder meetings and your other bipartisan work on MA? How is that different from the more partisan topics that you've worked on?
Yeah, I'll start there. I think one of the things that we did is we took meetings together. They have an annual rate notice. It's actually going on right now. But instead of this game of telephone that we saw on the ACA, Melanie and I would sit down. We want to hear from people directly. How could you? I wanted to hear what she had to ask. She always had really insightful questions about, well, how did you do this? And it allowed me to think through things. There's no doubt that the determinations of what the administration does and past administrations and going forward have impacts on how that care is delivered. Republican or Democrat, if you're enrolled in MA, you're going to feel the consequences of the decision. I wanted to hear that, and hopefully I brought those questions that Melanie could build off as well.
I think the other part is with MA and the nature of how it's structured, both of us took the role of being stewards of the taxpayer dollar, right? It's not just the consumer paying into the plan, but there were federal dollars, and really making sure that we could say, is this meeting the mark from a policy perspective? What could be better? And then also kind of thinking about, it grew a lot. I will say that it grew exponentially while we were working together on it as a policy area. So watching that growth and understanding why that growth, was it better for consumers? Was there something that needed to be refined to make it even better? And I think a lot of the work that's happening now in MA, even though you and I aren't doing it, continues that bipartisan conversation, the work around prior authorization, and how do you manage the price of insurance but also manage access. I think about what are the benefits that seniors need, what are the information that people need to make an informed decision. Like that continues to be bipartisan. But some of it was also, like you said, just sitting in the room together. One of the things that we realized in those conversations that people with end-stage renal disease were not able to be covered by Medicare Advantage from when end-stage renal disease was first brought into Medicare. And that was done because there was a new and novel life-saving therapy that was incredibly expensive. So Medicare, it's one of the few diseases where if you are diagnosed with end-stage renal disease, you can come in to Medicare, but you couldn't come into MA. And sometimes that was the only offering within a county. And so it meant people weren't getting go access. If we weren't bipartisan, if we hadn't sort of said to the plans, this is an important consumer protection, it's also about equity, it's also about better care. You say you can take care of the most vulnerable, now prove it. I don't think it would have passed.
No, I think that's right. And I think, care changes, right? And I think that's one of the benefits of MA is that it's supposed to be able to reflect the market faster. That was an instance where people were clamoring for it.
Yeah.
Hey, I've got this. MA is designed to bring a whole suite of services to manage this. I'm not stuck in a fee-for-service silo, even if I can get Medigap or supplemental insurance. That's great, but it's not managing the care that we really want. So, like Melanie said, let's give them the option. They don't have to, but let's give them that option, like they would have any other beneficiary, and see what happens. And it has turned out to be a fantastic result, and a lot of those people with end-stage renal disease are selecting Medicare Advantage because it brings that comprehensive suite of benefits.
Yeah. So with MA making up over half of the Medicare population, any conversation about improving or modernizing Medicare or restraining its spending and spending growth into the future has to include Medicare Advantage as part of that conversation. Are there particular levers that you think that people are going to reach for in a bipartisan way in the coming years as they look to MA for either dollars or health gains?
I think as we look at fee-for-service, that has not changed really how it delivered benefits in 1965. You have Part A, which is the hospitalization side, Part B with the physician. We added Part D in 2004, and the program started in 2006. MA allows that kind of laboratory of testing of how things work and how we can be more efficient. They've done some great things. How do we bring those efficiencies into fee-for-service and raise the bar? I think that's something, it's not a one-way street. It's not just let's ratchet down MA. Let's bring in some of those things we've seen. But the taxpayer support is going to be finite. We understand that Medicare is facing some real challenges in the years to come, and baby boomers are coming in and living longer and utilizing more services. Something's got to give. I think recognizing that it's not just an MA versus fee-for-service conversation. This is about modernizing the program to make sure it's working for the beneficiaries that are in it. And we're going to have some hard conversations, not dissimilar to what they did under Simpson-Bowles. I was lucky to be part of that when President Obama and Speaker Boehner set that up. I mean, we made some hard decisions, but a fundamental piece of that was modernizing the program to make sure it's being responsive to everybody that's in it.
And I think because it is 50% of the program, it's going to have to be bipartisan. Mm-hmm. It's going to have to be. And if you listened, the two committees in the House who have jurisdiction over Medicare had hearings with the plan CEOs earlier this year. And if you turned away from the screen, you didn't know which party was asking questions. The frustration about our taxpayers getting dollars, or our taxpayer dollars being used well, the frustration about barriers to care and administrative complexity for providers, those are universal. And I think that's actually where bipartisanship shows up. It showed up in the No Surprises Act. It showed up in a number of other things within healthcare, is when everybody gets to a place where they're like, this is the problem. And the problem needs to be addressed together, because if you don't do it together, it's all going to crumble and fall apart.
And you two were colleagues on the Ways and Means Committee in 2012, 13, 14, 15. Do you think staffers today are able to enjoy the same level of bipartisanship that you did, or is it different now? I think that the media environment makes everything feel 100% partisan 100% of the time. Tell me a little bit about how you see this at the staff level, the sort of invisible level.
You want me to go first?
Go ahead.
So in my new role at the University of Virginia, I want to bring people to Virginia. The number of staffers who are like, yes, I will do that, but I'm bringing my colleague. So they want to show the bipartisanship. They work well together, but it's not the things that are recognized in the media. I will say the places where bipartisanship works really well, and I think you and I did this really well, was when there's an intellectual honesty, and it goes, I said this earlier, it goes beyond the talking points, where you can know the person, you can know more than just like, oh, you sit in that office, you have that desk, you do these three things, but you get a sense of what brought them to the space, and a respect on both sides. So I'm going to share a story, and then, which is a little bit, Brian and I sit here and talk about bipartisanship, and it's important. We also sat in a meeting, I don't know if you were actually in this meeting, where one of my colleagues literally threw a book at the Republican negotiating the policy because she didn't think that he was listening. That break, that like kind of explosion in a meeting was really hard, and it broke down bipartisan talks for several weeks until they both came back and said, wait, we've learned, like we now know the information we need to bring to the meeting. And they continue to work together. This is 10 years later. So sometimes you have to get to like the pressure point and then come back to the table.
So I think staff have the opportunities now. You have to seek them out. You have to be you have to want to do that. We were fortunate enough to have bosses at the time that were seasoned enough to say, you know what, we're gonna forge ahead. I look at the things that we were able to do. Yeah, they were a little bit of lame duck members. You know, my boss, Chairman Camp, was terminated. Chairman Baucus on the Finance Committee ultimately became ambassador to China. Speaker Boehner was, not long before he retired. President Obama. So there was some deal making to be had. Did we know that was going to happen at the beginning of the year? Absolutely not. Right? So you can't work knowing, oh, we have to act by this date.
Right.
So I think what my advice to staff, if they're listening, would be do the hard work now. Do the spade work. Because you don't know when it's gonna happen. I was fortunate enough that the lightning did strike a couple of different times, but had I not been working with Melanie in 2011, then the fruits of our labor in 2014 and 2015 don't happen.
Yeah. And so if someone in our audience wanted to do bipartisan health policy, whether on or off the Hill, are there specific skills that you think are especially useful? What would you recommend people work on while they're still students?
I think listen, like truly listen. Engage in conversations and hear the other side and respond, in an effective way. And also read. For me, it was, I think the federal government does an amazing job when they do proposed rules. Mm-hmm. They do their proposed rules and they offer policies. Then there's comments back and they respond to those comments. And it's all public. Read them. Right, and then we're very fortunate to live in an age of technology where you can go actually seek out those comments, those 45 pages of comments that somebody submitted to them, read it, and call them. And that used to be the best part of my job. Was I'd read it, I'd read the little slice of it, then I would call the stakeholder and like, will you come in and do an hour-long meeting? I want to learn to a position I disagreed with or thought I did. You have to learn, and then you figure out what your philosophy on healthcare is. And I've developed one, and then you get to challenge yourself. But then I get a lot smarter, and then I'm more equipped when I go into those negotiations, and then those discussions or negotiations can be a lot more fruitful.
Yeah, and I would go beyond listen, understand. So it's not just I hear you, but it's like I now understand what your policy perspective is, so that when I am thinking about what I'm going to present in a negotiation, or if we have to resolve an issue, I can make sure that it's me. I can know where the pain points are going to be, but I also can know where the points of collaboration are going to be, and be able to talk about that. I think learning and listening and expanding and not being fixed in your ideology is really important, and that comes through continued conversations. It comes from reading. It comes from making yourself available to the hard conversations that they aren't always easy. You're going to disagree, but sometimes sitting in those disagreements allows you in this next conversation, because it is iterative, to be able to make a step forward. Mm-hmm. And I think the other part is, you alluded to this, these relationships need to be durable across multiple different issues, across long periods of time, and in different positions. There were times where you were in the majority, there were times when I was in the majority. The power shifts, but the issues remain the same, and sort of always recognizing that ebb and flow.
Mm-hmm.
So if you were to take off your policy staffer hat, and I know that that's the hat you guys have worn the longest, and try to put on an advocate hat, is your advice any different for people who are going to be more in the advocacy space than in the actual day-to-day policy grind?
I would say be honest and consistent if you're being an advocate. No, don't think that you can sell me one bill of goods and then sell Brian a different bill of goods, because when we have to go in and negotiate, we're going to compare our invoices. And if there's something that doesn't align, it's very often dismissed, right? Because there's not truth to that. Come with your truth, come with your perspective. And don't also expect to know what the policy position is. There may be a stated policy position, but don't just assume somebody's going to dismiss you out of hand. I think some of the best meetings I had were with people that fundamentally disagreed with me about the Affordable Care Act and would come in and explain to me why And then maybe at that meeting it didn't make a difference, but as I was thinking about policy, I think expatriate plans are a great example. I can be like, oh, where does this work for different types of plans, or how does this fit into our larger understanding of an insurance market?
I'm going to steal Melanie's line and understand. I remember being a very young Hill staffer, and I didn't know anything. And some advocates came in. One of them came from the NEA, and this was a time of some significant budget cuts. She did not want to talk to this young policy staffer. After multiple meetings, she came in, we developed a relationship. And she made a point to, I don't want to talk about these advocacy pieces. I want to know what's going on in your world. And my wife's a teacher, and we connected on that. And you know what? We ended up getting, after several years of her coming in, we agreed on a lot more than we disagreed. And we focused on those things. So when you're an advocate going in, know what your agenda is, and you should absolutely ask for it. But I bet there's something else that you can agree on. And if you can find that, you're going to be a better advocate. And you may not get there, but you got a shot.
Right. Can I ask just one of the things you just said? Don't dismiss the person that you're talking to. They may be young. They may not have a fancy title, but there's a good chance they're going to be the person walking with the member of Congress to the floor, right? Or they're going to be the person that's going to be sitting in there talking about something else, and the member will ask about something. So titles don't mean a lot on Capitol Hill. Everybody works really, really hard. I used to joke I could fix the Xerox machine and brief the chairman, and everybody was expected to do that. And I know from stakeholders, they're like, wait, I'm meeting with a staff assistant, or I'm meeting with somebody junior. That person is one day going to become the staff director. I think your career shows that. But also, the teams are small, and the access to the decision makers is not leveled very much.
And it's all about relationship. I think Melanie's point's right. I met with some people, and I was fortunate enough to have my career grow and become the staff director of the health subcommittee. You know what? We had a relationship. They would come into my office unannounced and say, hey, this is what we're here talking about. Okay, great. They had access that they would have never, because they put the time and effort in their relationship and their advocacy portfolio. So DC is a small town, and it's all about relationships. So you always continue to strive. And the only other piece I would say in advocates is make sure you follow up, right? Like the one thing that you come in, we take so many meetings on the Hill. We're stacked to back to back, and you might be in the hall. Follow up with information. Send that email. Follow up with the thing that you said you were going to do, and say thank you. They are pretty thankless jobs, and doing those little things go a long way.
Melanie, Brian, thank you both for sharing your experience and for modeling what respectful, substantive, bipartisan dialogue looks like. And thank you as well to our audience here in the studio and everyone who joined us online. If you'd like to watch this program again or share it with a friend, you'll be able to find it on the Harvard Chan YouTube channel. Have a great afternoon.